Which of the following is the most appropriate initial management for this patient? Administer intravenous immunoglobulin, begin plasma exchange, initiate corticosteroid therapy, start acetylcholinesterase inhibitors, or urgent intubation and mechanical ventilation. A 30-year-old man presents to the emergency department with a sudden onset of shortness of breath, difficulty swallowing, and slurred speech. He has a history of fluctuating muscle weakness, particularly in his proximal limbs and eyelids. His symptoms worsen with activity and improve with rest. Physical examination reveals a bilateral diplopia, and weak respiratory effort. Sorry. Which of the following is the most appropriate initial management for this patient? So, okay, I'm looking at this patient. So he has a history of pain that gets worse with that, or like symptoms that get worse with activity and improves with rest. He has ptosis, diplopia, and weak respiratory effort. Sudden shortness of breath, difficulty swallowing, and slurred speech. I'm kind of leaning towards, this could be completely wrong, by the way, what I'm about to say, but I think for some reason my mind went straight to like multiple sclerosis. Um, Trying to make more sense of this. What I would say then with what I think, it's probably start an acetylcholinesterase inhibitor. But if he's coming to the yeah, I don't know how this would be increased with anything else here, or how anything else would be better. Um, yeah, I don't think it's shortness of breath and swallowing. So I don't think you need urgent intubation if he was like dying, maybe. But he seems like he's at least fine in the moment. Vitals seem stable at least. I'd probably say that week started acetylcholinesterase.
Okay, final answer.
Final answer.
Okay.
Oh
So
man.
yeah. So the shortness of breath, difficulty swallowing, slurred speech, right? So muscle weakness, things like that, life threatening, right? In a sense of this moment. So I would probably intubate, right? But I'm trying to think. Yeah,
Myasthenia
myasthenia
gravis. Yep.
crisis. That's what it is, right? So, myasthenia gravis. The reason why is because worse with activity, improve with rest, right? And then I think Lambert-Eaton's a reverse, right?
Yes, it's yes, and I was yes, I knew that. That's what I'm saying. It's very frustrating. It's like I know that when I get done with the question, but yeah.
Sure, sure. And this is something you kind of you learn from, right? So this is what I call acute on chronic. Okay. This is something you'll learn later in third and fourth year, but concept's pretty easy. Meaning you have a chronic issue and then it gets exacerbated, aka like for instance COPD, right? That's a chronic issue, but then if you
Mhm.
get an upper respiratory infection that exacerbates that, then it's going to get really bad. You know what I mean? So if you
Pneumonia
have
kick into
myasthenia
it.
gravis and then all of a sudden you get an acute attack of myasthenia gravis, then that's going to be really bad on your body, right? Because usually it's pretty controlled, right? You just kind of rest and then you're fine, right? But of course, if
Mhm.
you get an acute issue on top of this, then you're really going to have issue breathing. And so the best way right now is to protect the airway. So that's kind of what they're trying to get at this moment in time.
Yep, that makes sense.